And you're live.
Okay, we are back. This is Senate Health and Welfare. We are continuing our testimony on H-265, an act relating to the Office of Child, Youth, and Family Advocate. And this morning, we're very pleased to have members of the Department of Children and Families here. Deputy Commissioner Radke, I will turn it over to you. I think you have a plan in place, so we'll just let you go right ahead with folks.
Thank you. Good morning, everyone. For the record, my name is Erica Radke, and I'm Deputy Commissioner of the Family Services Division of DCF. And I'd just like to acknowledge the Madam Chair and the members of the committee. Here today, we would like to discuss the Office of the Child, Youth, and Family Advocate in relation to the Families First Prevention Services Act. And I have with me today Jennifer Micah, Deputy Commissioner of DCF, as well as Beth Salzville, our Senior Operations Manager and FFPSA lead. And Beth has a really nice presentation to discuss the connection between the bill and FFPSA. And I'd like her to go through the PowerPoint presentation at this time. And then if there are any questions from the committee, all of us would be happy to answer any questions.
Terrific, thank you.
Just to clarify, I think Deputy Commissioner, you called me Deputy Commissioner. I'm General Counsel, Jennifer Micah.
We can only have so many deputy commissioners.
not looking to get bumped up.
Sorry about that, Jennifer.
We get promoted sometimes that we're called representatives, so we understand how this but go right ahead.
So good morning.
Do you want to share your screen or?
If I could, please.
Yeah, okay, let's do that.
Okay.
That works.
So good morning. As our Deputy Commissioner stated, I'm Beth Salzville with the Department for Children and Families, Family Services. I'm a Senior Policy and Operations Manager with the division and the Family First lead. Let me try that again.
Okay.
Sometimes our Can everyone see that?
Yes, we can.
Oh, that's great.
Okay. You know, it comes to this point of the year in Vermont where many of us, primarily myself, am looking forward to spring and springtime colors, etc. The flowers coming up. So in that fashion. So we wanted to kind of highlight for you all what is happening with Family First and the work of Family First as it relates to collaboration in particular. And our commitment to that. So in using Family First Prevention Services Act as a plan, the prevention plan as a platform for sustained change, we wanted to share with you some of the work that we've been doing probably since we presented to you all last. We've been organizing to address the issues at hand, organizing around implementation as opposed to planning. We've been highlighting the need for communications as a priority and the importance of family voice. I realize that this may be so small, but what I wanted to do, but it will be shared with you all, I wanted to share with you our governance structure for Family First implementation, and how we are organizing ourselves to accomplish the work at hand. We have a couple of things I wanted to highlight is over on the left-hand side is our state interagency team, which includes lots of departments, divisions, and outside entities as a way to take a look at the work from a planning perspective going forward to help to inform us from a multitude of lenses and make recommendations. In addition to that, we have kind of organized the work into what you'll see below as 7 work groups that will be launching in the very near future. And we're doing that with a little greater intentionality and transparency. And the reason that I put that out there is that while we thought we were organized well last year at this time and going forward and trying to get our prevention plan submitted timely, what we recognize is for the longer haul, it will require a little bit more information being provided to team members as part of the onboarding process. That over the course, this work will span for the next 5 years, but really for the foreseeable future in many ways. The prevention plan is a 5-year plan, but beyond that, we recognize the need for continual tweaks and improvements in all phases of the work.
Excuse me, Beth.
Beth, yeah, go
I'm
ahead.
sorry, I just have a question of clarification that might help me understand. Could you orient us a little bit? I think I know where you are and why you're talking about this, but is this a federal law that just passed and now you're trying to implement it? Could you just give us a little bit more context of this
Absolutely.
process and why you're doing it, et cetera?
Yes, absolutely. Okay. So the Family First Prevention Services Act was a piece of federal legislation that went into effect back in 2019. And we asked for a delay, a 2-year delay, and that was granted. Many states did as well. And to better assess kind of our current system, our current needs, and how we wanted to carry the work forward. There are many arms of FFPSA legislation. One of them involves this 5-year prevention plan that Vermont then submitted last fall, October 1st. We have been kind of in the revision stage. The plan that we shared with the legislature last fall upon submission was wholly on the surface accepted by the Children's Bureau, who's reviewing them for the feds. And we've just had to provide some tweaks along the way. Once that goes into effect, what that will do is to allow us to draw down Title IV funding for prevention provisions and prevention candidates that we have outlined in our plan.
Okay, and
Go ahead.
might be a silly question, but prevention specifically of what? That term is used a lot. So what are you trying to prevent?
Preventing children from coming into care.
Okay.
So both from,
Into state care.
yes. Yep.
Okay.
Yes. So being able to, and to being able to, what we did, and we can resubmit to you all kind of a few of our slides that we had prepared and talked about with different groups of legislators last fall. But we identified, and I say we had a prevention work group that was 80 plus members. And that group was comprised of both internal and external stakeholders. And what we did was we looked at some data. We had some data presented to us about, from different aspects, what were the types of cases that we were seeing at DCF, what were the primary issues that families were struggling with across the state that were causing children to come into care. And we looked at a variety of factors, and we, with the help from some of our federal partners, we then presented the group with, these are some of the programs that sit as supported on the Prevention Clearinghouse that we could draw upon and bring into our system intentionally to try to prevent kids from coming into care. And so that was a lot of the work of the prevention work group that happened last year. And then our shift, we submitted our plan with 2 evidence-based programs attached to it for year 1, and with the opportunity for continual amendments. And so we didn't outline what evidence-based programming we were anticipating in the years to come, but rather we did identify in Vermont several of the programs and programming that was already happening by both external partners and other departments and divisions that we might want to weave into our plan going forward. And that was a way to kind of to illustrate both what the state was offering in lots of different ways currently, and to kind of give a primer for what we might want to be looking at going forward. Now, our hope in terms of this structure, you'll see down below the prevention implementation work group and the 2 identified evidence-based programs as subcommittees of that. That will be the work of that work group going forward, will be to analyze, what we're seeing, to look at some of the data that we're asking of our providers, and to monitor the programs and the level of support that they're getting in an ongoing fashion every day within the Prevention Clearinghouse, which is the primary entity that we are asked to draw programs from. And then let me just pause for a minute there. Does that help to orient you to that piece of Family First?
Okay.
Can I just ask what the letters stand for in those 2 programs?
Yes. So PCIT is Parent-Child Interaction Therapy, or Interactive Therapy. I always mess that I up. And Motivational Interviewing.
Right.
Are the 2 evidence-based programs that we chose based on data that we looked at and the type of cases that those 2 kind of modes of service or modes of delivery work well with.
Thank you.
So some of the others, so the prevention piece of Family First kind of, sits as its own entity in some respects. The other pieces of Family First really have to do with, there's a provision around CHAFE funding for the adolescent population. There's a big piece around congregate care and qualified, the QRTP stands for Qualified Residential Treatment Programs. There's a big push under Family First to reduce congregate care settings and utilize that level of intervention only when clinically appropriate. And so we have been working on the pieces of the legislation around what programs need to demonstrate to be a qualified residential treatment program and what the states need to do to ensure that the right child or youth is being placed in the right level of treatment are all things that have been underway for the last year plus. And we are still working on those. And what that means for us as a state is that then allows for us to draw down Title IV funding for the children or youth who are eligible and are placed in that type of program based on clinical level of need. So that is another work group that is that was doing some work prior to the submission of the prevention plan that will be reforming and looking at that piece of the legislation going forward. The business fiscal work group is an entity that, you know, as you all are well aware, that everything has a dollar sign attached to it. So it's our business fiscal work group that kind of oversees, you know, all of these pieces of Family First and making sure that we are financially able to support them all in tandem with each other. The continuous quality improvement work group is really where the CWIS system will lie, the IT piece of that, as well as data collection and monitoring. We couldn't be more excited as a division to be really kind of on the verge of breaking ground in IT world around CWIS and really taking on data collection, a system that works better for us. And that we will be able to then report out to you all how we're doing in a multitude of different ways that we simply struggle with right now, as many of you are aware. The workforce prep work group is another piece of Family First. What we know is that to make sustained changes within our system requires, you know, some planning and discussion around how that should happen and who's going to deliver what and how that, you know, how the messaging will work and how we will know and all of those pieces. And that's the work predominantly of the workforce prep work group. The communications work group is really much more broad than that and really looks at internal and external communication systems. And I'm going to talk a little bit more about that in a subsequent slide. And then kinship navigation work group. So that is that's a piece of Family First to elevate the role and the support that kin hold for families. And we have been working. We're actually one of a handful of states right now that are on the verge of being able to work on validating a model for kinship navigation. So that's exciting work as well. And then what you see in that kind of peach line ribbon above all of the work groups is that, you know, that we expect that being integrated across teams is best practice standards, fiscal and claiming, documentation and reporting, and policy development out of those. And I would say that a majority of those work groups are completely open to whomever wants to be a part of that. We would welcome the input as we have with prevention. We would welcome the input from others.
So can I ask a question here while you're going through the different work groups? And
yeah,
the the work groups are made up of folks who are currently in the Family Services Division. Are there any new positions that are a part of the Family First programming?
So what I would say is that is not entirely the case. We took a pause on the work groups after the prevention plan was submitted to kind of reorganize and be clearer in the work of each of the work groups going forward. But even prior to the pause in the work groups, the prevention work group had probably as many external stakeholders as internal, if not more. The communications work group is a newly formed work group that is slated from the very beginning to include lots of folks internally and externally. The kinship navigation work group has always had external participation from the very beginning. And congregate care, QRTP, is very intentional in shifting going forward from having kind of a majority of internal stakeholders to having more of a mix going forward.
So, but it sounds like the folks who are already in the Family Services Division are taking on a new role and working through whatever work group it is. So are there any new positions to help accommodate for that extra layer?
What I would say is that it has been entirely voluntary. It has been, it has been very much kind of in addition to, there hasn't been, other than, myself as the Family First lead, and we have a prevention specialist that came on board a little less than a year ago now. We are coordinating all of that, and I think helping to support that through our roles, even though we're not the primary facilitators of many of the work groups.
And I would just like to support what Beth is saying. It's true that primarily the work is being supported by our existing staff, and of course the members, external members that Beth mentioned, and the only two new positions would be Beth's position and the person that assists her. So it's been a lot of work. It's a heavy lift, but it's really an important project that we're really excited about.
Okay, thank you. Good.
So in moving on from here, this is about making communications a priority. So we have intentionally thought about Family First, and then expanded that thought into the work of the division as a whole, and in using Family First as kind of the platform to look at how we do our work and how we communicate that both out and how we take communications in. And that was the work of the, we've done some consulting with Casey Family Programs around that. They actually just renewed a contract with a communications specialist to work with Vermont and with our communications team in an effort to really elevate the importance of communications. And what we mean by that, although certainly not limited to the scope of work, is that we're committed to a rebranding to better define our work. So whether that means kind of, taglines or logos, or, a way to kind of connect us to an image or a concept for the general public that better defines who we are and what we do as a division. We are in the process of redesigning our website, and we're dedicated to being more family friendly. and focused that on that. We recognize that right now when somebody goes to, well, and it's probably not indicative of just Vermont, when people go to a lot of states' websites, it's really hard for somebody of the general public to navigate that and to really get to, well, what's here for me? And we're trying to really think through that in a thoughtful way moving forward, and how we really want to be the face of resource for those who would most access it. We're looking at using a variety of platforms to ensure that information is shared in a way that meets different people different needs for different people. We recognize that in this world, as you know, that social media is, you know, even though I know it makes our attorneys kind of cringe, but that social media is a platform that is highly highly utilized by many folks, and is a primary way for folks to access information. So how can we work with that in this day and time and meet the needs of, of the majority of folks in different ways? And then looking at racial and social justice at all levels. Right now, we have several, we have a statewide, I have a blurb on another slide. We have a statewide racial equity work group happening with several sub work groups, and in that work have brought in experts to help to advise us, to help to look at different pieces of our system, whether it be at the intake, screening after hours, ongoing, to look at juvenile justice, and to look at our work from all levels to figure out how will we know when it's not working as it should, and what will we do about that? How can we, how can we do things differently in a way to meet the needs of racial equity, social equity? We have lots of teams kind of working in collaboration with the communications team. And that's kind of what this slide in part illustrates, that we recognize that communications will be embedded in all of the areas of the work that we're going to be doing intentionally around Family First, and really are proud of that. So some of the...
I'm sorry, just a real quick question. You'll probably be getting to this at the later on, but can you give us an idea of when we'll see full implementation of this work, where we'll see the transformation having taken place? What's the end point here? What's the timeline?
Well, I would say that is probably like a little bit like holding a bowl of Jell-O, in that, as we know, sustained change takes time. That it's more than just saying, okay, we're going to do things this way, and voila, it happens. And so I do think that it will be easy to be able to update folks along the way about pieces of the work that has happened, but it may, I don't want to give false hope that any of this we're anticipating to happen overnight.
But so is there a federal requirement for demonstrating some outcomes on this and demonstrating that change has taken place? The federal deadlines, so I'm going to be able to answer that in a couple of ways. When it comes to the delivery of our evidence-based programs under our prevention plan, there are absolutely key data elements that we will need to report out on an annual basis to the federal government to ensure that we are identifying our candidates as we said we would, that we are delivering the services as we said we would,
And, and then this is the data to demonstrate that. So that's one piece of it. In terms of some of the other work, a lot of that, the feds do not have an intimate kind of involvement with in an ongoing basis. What they tie it to is that, Vermont, you will know if you're doing what you should, because you will be able to draw down Title IV monies, and you will pass an audit that says you drew it down in the way that you were supposed to under these provisions.
And I would add that, Beth is right that it's sort of hard to give a hard and fast timeline, but looking at the 5-year plan and knowing that we are absolutely moving toward hitting those benchmarks, and that the drawdown of that 4E money is critical to our working. Looking for substantial progress year by year is what I'm looking at as a leader, and I'm hoping that as we move closer and closer to that 5-year mark, all of these initiatives that we're pushing forward, we will be able to see substantial progress. So a timeline in the 5-year mark, making forward progression is my aim.
And if I could say one thing is in the budget bill, there is language around having a judicial master, which will assist with making sure that youth are appropriately placed and not placed if unnecessary. So there are things that are like concretely moving forward now.
Wouldn't, you mentioned that you're trying to prevent children from going into state custody. Wouldn't you know you're meeting your goals if fewer kids are in state custody? Wouldn't that be the outcome? Not just drawing down dollars, but actually preventing kids from being in state custody because they are supported in their families.
Yeah, I think that, I mean,
point. Go ahead, Beth.
I was going to say the same thing. I think that's an excellent point. I mean, that will be one of the key data elements that we will be looking at to measure our successes. But we also, in addition to that, know that our communities are very resource strapped right now. And so we know that it will take a period of time to increase the number of resources to really feel confident that the resources that we're infusing in the communities, these evidence-based programs, are really part of the solution.
Yeah, I would just add on to that. It is a diversion of monies from residential into communities, and we will be looking at things like providing monies to like the public defender offices to provide social workers so that they can work with families more closely and prevent kids coming into care. So the money goes hand in hand with the decrease. We need the money to provide the community supports in order to ensure kids can stay in their communities.
Okay, so you implement the evidence-based strategy. I'm just trying to get the order here. You implement the evidence-based strategies in the communities in order to demonstrate that you're doing what you need to do to draw down the federal dollars. You draw down the federal dollars to be able to have more resources beyond those strategies, and then you prevent children from being in state care.
But in the meantime, you need money to start with.
Yeah, so is that right?
I think that is absolutely a big piece of it. Sure. Yes.
Okay, I'm just trying to figure out the order of what you're supposed to be doing, and then how you're supposed to get to the income, the outcome that that is required, and that of course I think probably all of us want to see. Right.
I think, in a lot of that, I would say, we already have been doing, but, under Family First, we have the ability to do a little bit more.
Okay.
So this slide we included to just highlight some of the current processes that are in place to guide our work. And so we have lots of, currently have lots of outside organizations and voices that help to inform our work. And we've, kind of highlighted the importance and the relationship with some of those here. I talked earlier about the state interagency team and the voices of that. Evident Change is an organization that we have worked with that help us with our structured decision-making process as it relates to risk that families pose, risk of re-entry into the system, risk in terms of identifying and matching families with resources. We have our Family First working teams that I just talked about. We have our federal partners through Casey Family Programs, through the Center for States, that are helping to work with us to examine our processes and our systems to make recommendations for improvement. We have VCAB that has been a partner with us and has spoke on our behalf about some of the deficits, as many of you know, within our system. We have the St. Joseph's Orphanage Advisory Council, of which they have asked Family Services to be a part of. And so we have a lot of folks right now. And so this was just a way to kind of illustrate that and to think through that. We recognize also that an ongoing challenge is that ensuring of continually moving forward within a complex system. And this is, kind of, a little bit, of the questions, a couple of the questions that just came up, that all of these are continually moving parts, and that we are trying to make sure that we don't lose sight of, and that we are, and what group needs to interface with what other group to make sure that either there's policy changes or process changes within our system to achieve better outcomes for our children, youth, and families.
So quick question, what data are you using to inform your decisions to make specific changes?
So it depends on what the topic really is. Are some of our challenges with data for sure. So it depends whether it's, it may not, the data may in part be the recommendations out of one of the studies that were recently done. So it may not be kind of a piece of internal data, but we can use our internal data to say, and this is our baseline measure. So for example, and I think I might mention this on a subsequent slide, when it comes to evident change, what we looked at with regard to the UVM study that was done was the rate of entry and how that is impacted by our risk assessment tool. And right now we are in the process of working with evident change based on that study and based on what we know, what we can pull from data in our system to have that tool recalibrated for us as one measure of that. In addition to that, we part of the work that has been happening through the racial equity work group around, in particular, around juvenile justice has been the work and the collaboration that we've done with New York State, which is where the YASI tool, the Youth Assessment and Screening Instrument, originally kind of, they were our mentor in utilizing that prior to us, and where we kind of got the idea around the utilization of that tool. but we're looking at the fact that New York was able to significantly reduce their own disparities that were identified through the use of the YASI by establishing new cut points to align risk level with actual recidivism rates. And so we're utilizing that to relook at our own tools and to figure out how does that impact us, and how can we how can we really delve into kind of looking at where our own cut points are in the utilization of that tool as a way to reduce disparities when it comes to racial equity and the use of that tool. So those are a couple of examples of, where our data is coming from and how we're utilizing it with other information that we're obtaining.
And I would add that actually Beth is part of a work group that's really doing a crosswalk between what we're learning with the prevention plan and with the UVM study, as well as with our own strategic plan, to find out where there are areas of agreement and where there are areas where we can learn and make some progress for areas where we're weak. So that's another area, in addition to what she was talking about with the structured decision-making tool, where we're going to make use of that UVM study to make sure that our practice and our policies are doing what they can to help children as best as possible.
Yes, thank you for that reminder. That's an excellent point, and really something that I did want to highlight in the when I spoke about earlier about the CQI, the continuous quality improvement work group, is that will be part of the work that work group will be tasked with, that is absolutely open to external stakeholder participation to help us to examine our practice there, and what do we need to do? How do we weave in the multitude of information that came out of both the public consulting group study that was done, as well as the UVM study and reports that were issued as a result of that? How do those pieces tie in, along with Family First, to our ongoing strategic plan? How do we intentionally weave those in so that they don't get lost as just part of another report?
Good point.
So, and we continue, I think we've talked about this last bullet, about weaving in the voices of others outside the system into our work. I think that Family First, we have always tried to do that on some level, and many of these bubbles around FSD have been in place long before Family First, but I think that Family First and that legislation and the intentional focus that FSD from our in DCF from our DCF commissioner on down in the last year has given to it has really elevated the focus and the intent. So in looking at the bill around the Office of Child, Youth, and Family Advocate, and enhancing the current system versus duplicating efforts, wanted to just do a quick kind of crosswalk between the two. And some of these, we have already touched upon, but also wanted to open it up for questions. So addressing racial and social equity with service delivery of family services, I talked about a little bit about the work that has been both Erica as our deputy commissioner, as well as Brenda Gooley, who's our director of operations, have been champions in supporting that statewide effort for at least the last year. I don't remember, Erica, it's been going on quite a while now, and all of the subgroups wanting to make sure that FSD leadership is heavily infused in all areas of that work to ensure the coordination and forward movement around recommendations that are made. Elizabeth Morris is our primary point of contact, and And we are open to any feedback and participation as well. Providing oversight to drive reforms to the system. As I mentioned, the Public Consulting Group and UVM were independently conducted studies to evaluate the many facets of our system and make recommendations for improvement. And, as I, gave you this example a bit ago about the work of evident change and making sure that we have the right gates into the system. As well as the crosswalk, as Erica had mentioned, between those reports and our strategic plan and Family First, and ensuring that the key pieces of those and the recommendations are intentionally infused in our plan to move forward. The work with parties to strengthen the department's services. We are, as I spoke about earlier, we're continuing, we are on a continual path of examining practice and wanting to improve. And Family First has given us a way to kind of have renewed focus and commitment to moving forward around that. And then analyzing and monitoring federal and state and local laws and regulations and policies and recommend changes. We feel that there is ample opportunity and transparency within all of the areas of Family First, and continue to welcome participation. I know that we have, certainly extended that invitation to many of you in the past, and that invitation still stands, that anyone who wants to be a part of this work going forward, we're ready to bring you into the fold.
I would like to add, in terms of Family First, it really has been a driver to help us move forward with our CWIS system, and also what Beth was talking about in terms of being able to rebrand and having a significant push in terms of advertising and making sure that the internal and external stakeholders, as well as the public, know what we're doing as a division. So I just wanted to reemphasize that Family First has been a really good avenue for doing a lot of the things that OCA feels is necessary for our division, and what we feel is necessary as well.
And then I always, we, in making an effort to hear family and youth voice, I thought that it might be helpful, and always for our staff, our feel good moments as well, to to hear what those who we're serving have to say. A couple of slides ago, I talked about different entities interfacing with our system. And as as many of you may already know, we have a contract with folks statewide for our youth development program. That's a program that interfaces with our young folks and our adolescent population and emerging adults now, that is able to help and be a resource for that population, well into their 20s. And I wanted to share a few quotes from the youth development coordinator in Bennington that a few of her young folks had to say about their work with the program. And the reason that I think that's significant is that when I think about that, adolescent population and how tough they can be sometimes, quite honestly, to work with, to engage, to to feel like they need any help from adults. But there's a lot of good work happening within the division and with our, contracted partners. And this is, these were a few comments that within the last week that were gathered to illustrate that. And then also, this was a quote that was gathered from a family, from a father who worked with one of the front end workers in our Springfield office. And I won't take the time to read this to you all, and you all will get this. But essentially, it's just one more example of the kind of work and kind of engagement that our workforce is experiencing on a daily basis. This was a man, and he and his wife had 4 children, and we got involved, and he talked about that they were angry about our involvement, and they were angry about who they perceived to have reported them, and then how the ongoing kind of relationship with the DCF worker, how that transpired over time, how they were perceived by the family, and then what does the outcome look like now? And the worker that provided this, quite honestly, just said that she actually had just run into this young man who is, has a very solid employment and great self-esteem, and that was really feeling like that their interface with us, even though it was not initially welcomed, turned out to be a blessing in disguise. So just, it's just a really good example of the work that happens within our division. And then we just wanted to share also, kind of some thoughts for consideration around what will the checks and balances be for the Office of Child Advocate. To point out that our FSD workers receive a lot of training and oversight to ensure that their access to to information via powerful databases, et cetera, is not abused. How will that training happen? How will a small office be able to accomplish what takes dozens and dozens of folks statewide to organize and plan around? So concerns around capacity. And then, to kind of reiterate a point that I made earlier, to recognize that large system changes take time and resources. So, those are certainly, some points that we were thinking of as we were thinking through both our work and what we've experienced boots on the ground, as well as the proposal before you.
Okay. Well, yeah, good. So committee questions for I guess everyone here who's here with us. It's great. So well, just generally what I heard you say around the Office of Child Care Advocate is there. I feel like you're saying that you're doing all the work that you believe a child care advocate might be pointing out for you to do. And at the same time, we're hearing a lot of folks who would like to have an Office of Child Care Advocate. And my concern continues to be that there be a collaborative relationship between family services and DCF overall with any Office of Child Care Advocate. And so we'll have to put all of that together as we continue to look at the bill. And also understanding that there are other parts of state government that would be implicated within an Office of Child Care Advocate, but certainly your role and your expertise is critical to whatever happens. So We appreciate the time that you've taken to think this through with us and for us. Go ahead, Senator Hardy has a question.
Well, thanks, Beth and Erica and Jennifer for your presentation. I'm trying to absorb it and get oriented, obviously, at the beginning. So, but in your feedback on the sort of 4 points you make about the Office of Child Advocate, do you have for example, suggestions for training and oversight that should be required, or suggestions for how we could, improve the language for relationship building, et cetera? Or obviously capacity concerns is something everybody has, but I guess, and checks and balances. So do you have specific suggestions, or do you want to, did you just offer those for us to think about?
I think that what we would like to get together over the next couple of days to discuss what we could offer around those things. So we will be coming forward to you with some concrete suggestions around those issues.
Okay, great, thanks.
Terrific, thank you, that's good. Good question. Any other questions at this point? Well, I think we'll wait, we'll see what you bring to us, and we'll be working, of course, with others and with our ledge council as we look at the bill.
Do you mind if I don't, so in thinking about this office, we have other advocates in state government that we work with. The one that this committee works with the most, probably the healthcare advocate. And from my perspective, I'll just speak for myself, that position is really helpful to us and helpful to people, our constituents who might be having concerns with the healthcare system. And I sort of think about this that this position would be similar to that. And I was just scrolling through trying to find the statutory language about the healthcare advocate. Maybe this is a question for Katie, to be able to sort of do a comparison of, what did we require our predecessors require for the healthcare advocate office, and how could we learn from that office? Because from at least my perspective, it seems to work pretty well. There's also a tax advocate that we sometimes work with in my other committee. So there are other advocates in state government, and wondering if you've looked at those and to try and talk to your counterparts in other agencies about how that might work in this area. You're muted, Jennifer.
So I haven't spoken with them directly, but I am familiar with them because of my work when I was an assistant attorney general. I worked with legal aid, and I think that when I testified last week, I did propose that the advocate be in Vermont legal aid. I think that's right. Yeah, and I think that, and if you look, the long-term care, it's an ombudsman, and the healthcare is an advocate, and I would be interested to know if they see their roles differently in that regard. But yeah, we definitely would have a lot to learn from them, and I will be reaching out to them.
That is a good point. The difference between an advocate and an ombudsman or an ombudsperson. That's an awkward term, but there's got to be a better term for it.
I think the term for the ombuds is, I think that it allows a little more flexibility in mediating disputes and in seeing the position as less adversarial. An advocate usually takes a side. It's sort of, as a lawyer, that's how I see the world.
Yeah. No, that's a good point.
That's helpful. Good. Okay.
I would agree with that the concern would be an advocate. There might be more of a built-in tension or adversarial relationship that you might not find then with an ombudsman.
Okay. So thank you to each of you, Beth and Jennifer and Erica, our Deputy Commissioner, lawyer, and leader. Well, we really appreciate the time that you've taken to educate us on all of this. And we look forward to your comments for the bill. And because we want to act on this sooner than later. The bill's been on our committee for a long time, but we need to be sure we get it right. So thank you.
Thank you so much for having us.
That's right. So we're gonna move on to Linda Johnson, who is here from Prevent Child Abuse Vermont. And Linda, thank you for being here.
Well, thank you for inviting me, Chairperson Lyons. Good morning to you all, Vice President, Senator Hardy, Senator Cummings, Senator Hooker, and Senator Terenzini. For the record,
Thank you for the promotion there.
So is she Vice President?
that's what I was
I'll
told.
take
So
it.
sorry. Hope I didn't step on toes. I apologize. But you're all wonderful. There's no question about it. So for the record, I know I have this right. I'm Linda E. Johnson. I'm the Executive Director of Prevent Child Abuse Vermont. And I'm here to testify regarding the importance of having an Office of Child and Youth Advocate in Vermont. I believe establishing this proposed entity would greatly aid in the protection and health of children and youth who are in need of more advocacy and whose parents may be as well. Over my 36 years in my current position, and the 7 years before being the executive director of the Lamoille Family Center, I've been reached out to more times than I could actually count for help to intervene with a family involved with DCF. I'm not here to bash DCF. Let me be clear about that. I have a sense of the difficult work they perform, social workers and all, helping parents and children impacted by drugs and alcohol, domestic and sexual violence, and more. Their workloads and the vicarious trauma impacting frontline workers is a burden not for the faint of heart. They are heroes quite regularly, establishing safety and helping families heal and recover from multi-generational despair and trauma. Sometimes they nurture new healthy families into being through adoption. A wonderful thing to celebrate. I could go on, but today I'm here to talk about the missteps that occur and have come to my attention from parents, PCABT staff, journalists, attorneys, other human service providers, and advocates. When a situation where poor social work, prejudice, negligence has been shared with me, I bring it to someone in the central office for a deeper look. I've been gratified that over the years, in the vast majority of instances, corrective action has been taken. I do not know how many folks like me are out there being turned to for help when things are unfair, unjust, not safe, and not well managed. It is happenstance that I'm someone who's willing to speak up and ask for this kind of assistance. It is also happenstance, though, of course, the right thing to do when someone in the central office is willing to help. I believe it is in the very best interests of our most vulnerable children and youth that we establish an independent Office of Child and Youth Advocacy in Vermont. There must always be someone who can look into, explain, communicate honestly with all parties, and advocate for really the best interests of the child. I further believe that this office needs to be part of state government, so that records are easily accessible. I also recommend that an oversight commission of non-conflicted individuals be named to serve on this body. The office needs to be set apart from DCF, and like the Governor's Commission for Women, report directly to the governor and not to the Secretary of the Agency of Human Services or any commissioner. I celebrate the family first prevention work that's taking place, but this is a child by child kind of work. Systems do not fully represent all the work on the ground. And as has been mentioned very appropriately, systems change, and change on the ground takes a long time. From my experience over the years, I would say It takes decades. And even then, because human beings are unique and fragile and reactive and sometimes in it for the wrong reasons or overwhelmed, serious mistakes happen. Very serious mistakes happen. And having an outside entity to turn to for resolution and protection is essential. Thank you.
Well, thank you. I know that there's a lot of experience behind the words, and we appreciate your work and your words. So it would be helpful to have your testimony in writing.
You have it. You have it.
I guess, is it posted now? Not posted yet. So yeah, we'll make sure that we have it. Erin will connect with you if for some reason it's not there. So committee questions for Linda. I guess, let me ask you this question first, and then, because we just heard about Family First, it's a whole systems change, as you said. It doesn't necessarily mean boots on the ground. We're trying to figure out, we want to make sure that happens. But we also have concerns about any office of child advocate and oversight becoming so focused in on DCF gaps or problems that we forget, as you were talking earlier, we forget the good. And then also how we can ensure, if you've given any thought to how we can ensure that there is a collaborative working relationship between any Office of Child Advocate and DCF. I know it's a balance, but any thoughts that you might have on that?
Well, in terms of celebrating success, I think that Beth and Erica are really on the right track when they're talking about social media and really tooting your horn and changing the website and making it family friendly and opening it up to the messages that you want to be giving to the community of parents and youth and the wider community that has opinions about DCF that may or may not always be accurate. You have a legal responsibility to protect children. You cannot get away from that, and I wouldn't have you get away from that, because the pendulum swings both ways, and we have to be mindful of that. While I say that, I think positive, caring, nurturing social work sometimes goes as far as you need to go. The assessment track was one of the best things that ever happened in my experience over the years, and really dramatically changed options for social workers. If there's not enough evidence to confirm child abuse and neglect or do an investigation, offering services, providing support to head folks in the right directions and to connect them with services like ours and others to help them build a healthier family. That is so important. And letting folks know that you do that is equally important. So I think image change to an extent, but you can never get away from your legal mandate. You are the folks who are responsible for protecting children who are being abused and neglected. And you also help people go in the right direction and heal, and often multi-generations of trauma are what's going on. So you have a big job. There's no question about it. And you're not going to get it all right. You just can't. It's too big, too complex, and human beings are all of that. Very complex. I think oversight, well, maybe it's not exactly oversight, but a place where parents can go and advocates can go, and anyone in the community can go when they think something is not going right. And I just think it's necessary, because you can't honestly tell us that you're going to get it right every time. And you can't honestly tell us that the supervisor is going to be aware of that and intervene. It just doesn't happen that way. Systems are great. And the central office crew is phenomenal. But boots on the ground, face to face, it's a different matter at times. And
Thank you. Yeah, no, this helps. This just helps a great deal. And Aaron just checked, we don't have your testimony. So if you don't mind, sending it in, to Aaron, that would be terrific. Yeah.
absolutely.
Senator Hooker, I think had a question or?
No, well, and I don't know if this is just gonna be duplicative, but, one of the side by side was, why the Office of Child Advocate, or should we, or does it duplicate efforts? And I think you're pointing to things that show that it does not duplicate the effort. And I'd like you just to expand on that a little and how you see it as being different. DCF is doing its job. Where would the office add to or expand or allow
It's an option.
other voices?
It gives Vermonters an option, another place to go to say, would you please look at this? Something terrible is happening here. Or, my husband who's Black is not being allowed to visit our child. Only I am, and I'm white, and I did the harm. I could just go through a litany of so many situations over the years. A court case that was decided by the Supreme Court that did not allow for children to come back home who had been voluntarily given to DCF for care while the parents went through drug treatment. And they were adopted out, and it was not right. And years later, the Supreme Court said so, but at that point, it was too late to return the children. It was just too late for those children and for those parents. I mean, it happens. It happens. I cannot imagine that there is a DCF system anywhere in the United States that does not make mistakes. I just can't imagine, unless it's run by robots. I mean, I just really cannot imagine it. So I don't know if that's helpful. Does that answer your question?
Thank you.
Yeah, this is all very helpful. We're getting a whole lot of information, and it's going to take us some time to look at it together with legislative council, and perhaps there will be modifications to what's come to us from the House, and that's our goal, is to figure out the best path forward. So I'm gonna suggest that, unless there are some burning questions right now from the committee, that we're gonna go off YouTube and end our meeting for the day.
Say hi, Linda.
Hi, Ian.